June 2003, I was walking up the ramp to the emergency department. I was the assistant nurse manager there. My last thought walking up the ramp was, I feel like I have an irregular heartbeat. And that was the last thing that I remembered. I went into sudden cardiac arrest. One of the nurses happened to be walking outside to discharge a patient, saw me, carried me inside, and proceeded to resuscitate me for the next 45 minutes.
So in the United States, there's about 365,000 sudden cardiac arrests each year.
Sudden cardiac arrest occurs, literally people fall over and they are not breathing, they're unresponsive, and they have no pulse.
Whether it's young or old, it happens out of the blue. The only treatment is CPR and AED access.
CPR is wonderful, and it will restore circulation, but sometimes that is not enough. And in the event of something like this, where you need electrical stimulation, that's when the AED is so utterly important.
Lancaster has been very blessed by a robust program of AEDs in the community, especially in police cars. And oftentimes, police are the first in the scene.
Having the police well equipped with AEDs and good training is paramount to success. Our response times are about 9 minutes, about 80% of the time, which decreases the chances of survival significantly.
Penny's also a classic example of the importance of defibrillation, and not just defibrillation, but early defibrillation. If her care had been delayed for minutes, she would not have survived. That's why it's so critical to have early defibrillation for patients of sudden cardiac arrest.
One of the biggest differences in an emergency department, you have physicians that are reading your cardiac rhythm. An AED does that in the absence of a provider. It interprets that rhythm for people and can administer the same kind of therapy that you would get in an emergency department if an ER doc was standing right next to you.
Once you apply the AED, it's telling you what to do. You put the pads on, it analyzes the rhythm. It either tells you to deliver a shock or not, and in some cases, it just does it automatically. It tells you to get out of the way, it tells you to start CPR.
I would encourage anybody to be familiar where AEDs are in your workplace or in your gym. And I ask places, where's your AED, where you expect an AED to be? They don't have them. They don't have them because they don't have access.
To give that same opportunity to people out in the community for resuscitation as immediately as I did with such good neurological outcomes is huge. Having AEDs available in the community is essential.
These patients that we respond to are your friends, your family, and quite possibly maybe even you.
AEDs are an absolutely life-saving, critical device in the time of sudden cardiac arrest. There is nothing else that is as effective. We can get these into the community, lots and lots of them in the community. And I thank you for your time and support.
AEDs save lives. Thank you for your donation.